just like previous life. Anterior is always challenging, you know. Anterior is always challenging. Everyone loves anterior because anterior is the only restoration that can judge by the patients, right? Okay. So yeah, let's wait for another participant. This is free for all of you, yeah. In the quarantine, I hope everything goes well, yeah. Okay, let's start it. Let's start. I will turn off the command first. Okay, anterior restoration. First, I want to talk about bevel. You know, bevel is really important in anterior because there's no way to hide a different shade of composite. There's no way to hide, you know, to make color the same unless you have a good bevel. So what bevel you should have? You know, I really disagree with the principle about the minimal intervention or minimal invasive bevel, because the principle is the more bevel is the better for aesthetic. Yeah, but you have to know about the limit to put the bevel. Yeah, don't make it too much, don't make it too less bevel, because bevel guarantee you a correct shade matching, good transition between tooth color and then composite. Yeah, so this is bevel that I always use. Yeah, the name is starburst bevel. So basically, this is invented by Dr. Brian Lesage. So this is very good bevel. You have to do this bevel. Maybe the concept of minimal intervention will works in this particular case, such maybe a very shallow cavity. Let's say it's like cheap tooth, class 4. But for a black cavity, like class 3, big one, it's impossible to do minimal intervention. Yeah, you have to do this bevel. Yeah, the more bevel you have, it's the better. But how deep is bevel, how wide the bevel, that we have to define later on. Yeah, it depends on the case. So starburst bevel, this is very important. Starburst bevel means randomness of the depth and the width of the bevel. Yeah, the more you create depth and different width of the bevel, I would like to call the starburst bevel as a irregular bevel as well. Yeah, because basically you're not creating a bevel on the same level. You create something like a wave, yeah, in the cavity, so that the composites, yeah, I will have the scheme after this. This is the literature about the bevel. You can read the journal, you can read in the article. You can see that the bevel, the starburst bevel, is really recommended. Yeah, and bevel restoration, especially in anterior, guarantee you good longevity and higher fracture resistance. Yeah, if we compare to the cavity that has not bevel. Yeah, and this one also, starburst bevel is recommended. Yeah, starburst bevel is recommended, especially for the tooth that has a black cavity. Yeah, maybe minimum intervention bevel will work for that tooth with a minimum cavity, like cheap incisal or maybe small class 3. But if it is black cavity, yeah, class 3 deep, it's impossible to do a minimum invasive bevel. And then this is the concept. Yeah, everybody is always asking me about how many composites should be placed on the tooth, on the cavity. So the minimum composite that you should place on the tooth is 2 layers. It's impossible to create aesthetic restoration for anterior by using only 1 layer. Yeah, no matter what the supplier said that this is will works, this is chameleon effect, that's impossible. Yeah, so to create an aesthetic one, we need at least 2 layers of composite. So we need dentin, we need enamel. Yeah, for dentin, I use the opaque one. We have to cover all the dark area of the tooth. And then for the enamel, I choose high polish enamel. Why? I will tell you why. So, like I told you before, monochromatic is impossible. So basically, we require minimum 2 layers of composites. If you're reading the journal, if you're reading the article, they said they have pentalaminar, 6 laminar, or maybe 100 or 1000 laminar. But I think I want to simplify all the procedure. So what I'm trying to over here is only by using 2 layers, and acceptable for the aesthetic and for the longevity. Yeah. So monochromatic is impossible unless it's only enamel involvements. Let's say it's only chip incisal. Let's say it's only a little bit cavity on the class 3, and proximal. You can use monochromatic. But if it is very deep, if it is dentin involvement, you have to create with minimum 2 layers of composite. So anterior composite, I would like to say like this, 80% is color or shade matching, and 20% is the illusion. I will tell you what the illusion is. First, why I say 80% color or shade matching? Because there's no exactly 100% correct shade. Even if you use polarized, even if even your eyes judge that tooth has the same color as your composite. That's impossible. Impossible to replicate 100% correct shade. So 80% it's good. 80%, 70% is good. And the rest is 20%. 20% is the illusion. How to create an illusion? You have to create a very good polishing. If you have a shiny surface, if you have a good polishing surface, your patient's your eyes will create an illusion. And so that if there is a little bit of miss shade matching, your eyes cannot see that because there is an illusion. So that's why I choose enamel with the very good polishing ability. So I always say in my seminar, do your feeling just like painting on the canvas. Painting on the canvas is literally like painting on your canvas. So I have a scheme, very good scheme here. Let's say the cavity is class 4. The first that you need to rebuild is the palatal wall. So basically it's just like restoring posterior case, class 2. Basically you need to make the proximal wall first. This is the same thing. You need to create the palatal wall first, a very thin one, and then after that you create the proximal wall. After that you put a dentin. After that you put the enamel. Let's talk about the palatal wall first. Palatal wall, you need to make it very thin. The same composite as you use for the outer layer, for the last layer. The palatal wall, you can use flowable or you can use packable. Why, how, or when you use flowable, when you use packable? You use flowable when there is irregularities. Let's say for the example, the patient has a fracture. Usually if the patient has a fracture on the palatal side, some kind of wavy area, irregularities, you can seal that with the flowable. But if it's only class 4, with the flat situation like that, you can only use packable. Let me tell you, packable is way easier than we use flowable. Using flowable needs experience, but using packable is way, way, way easier. When there is no irregularities, like I said, if the palatal is flat, no irregularities, the border is good, you can use the packable. How about the proximal wall? Proximal wall, same as a palatal. You have to create it very thin. And basically, you have to use the enamel. Just remember the anatomical structure of the tooth. Palatal wall is created by the enamel. The outer layer always the enamel. The proximal also the enamel. So you need to use it, your enamel layer, your composite enamel. You use packable composite for the proximal. It's impossible to use flowable in this area. For me, I'm never using wedge. It's kind of preferable, I think. You can use wedge, or you cannot. You cannot even use wedge. But for me, in my case, I always use my instrument, my plastic instrument, to hold my matrix. I will tell you in hands-on. So I have tips here. After you build the palatal, sometimes common mistake is when you pulled out your matrix strips or your silicone index, the palatal wall will be broke. So to avoid that, always after you create the palatal wall or after you create the proximal wall, always put thin layer of flowable in the junction of cavity to strengthen your wall, so that when you pull out the matrix, when you pull out your silicone index, it will stay there forever. Okay, same thing after you create a proximal wall here, you always put a little bit or thin flowable there to make sure the junction between cavity and the tooth is good. Okay, now let's talk about dentin. I will make it fast. For a dentin must be covered half of the bevel. The idea is, the principle is, the enamel only, the space for enamel only 0.5 millimeters. It's very thin. 0.5 is very thin. It's very hard to define 0.5 millimeters for the enamel. So let me tell you, if you already know about the instrument, the instrument called Misura for LM Art, from LM Art. I have one in my clinic, but when I used that, I found it really difficult to use. So I did a little bit of experiment, and I decided that dentin must be covered half of a bevel. After you cover half of a bevel, your starburst bevel, and the rest should be about 0.5 millimeters for the enamel. And my principle is, dentin must be covered all the dark area. That's the thing. You have to remember that dentin must be covered the dark area. Let's say if you have a black cavity, if you have a affected dentin there, you place a dentin. You place dentin. But when you think that the dentin is not covered full, the dentin, or you can still see the dark area, it means you will have a grayish situation, grayish result. So dentin must be covered, already covered the whole dark area until you cannot see that anymore. That's the thing, that's the secret. But how thick is thick for a dentin? Maybe you can easily put a dentin all over the tooth until it's already covered, but the result will be whitish, right? So you need to make sure you need to always check on the occlusal to see how thick it is. This is a common mistake. This is a very good scheme, but actually not very good picture. But it's okay. This is a common mistake. I oftenly found it in my participant, in my hands-on. They put dentin like this, from the incisal, from the bevel until the incisal is flat like this. This is wrong, because dentin placement, dentin composite must be follow the anatomical structure of the tooth. So this is the bevel. Like I said, this is the correct one, covered half of a bevel, but the wrong placement is dentin should be less on the incisal. Or maybe if you want to create, let's say you want to create a mamelon, like halo effect, something like that, you need to make space here. No added composite here. So this is the correct placement. You have to follow the anatomical structure of the tooth in order to create such an aesthetic result of anterior. Yeah, this is the correct placement. So dentin, the more incisal is the less dentin. The more cervical, dentin must be more. Yeah. How about the enamel? Enamel, like I said before, enamel, you choose the enamel with a very good polishing ability. Yeah, for my case, I always use Tokuyama. Tokuyama family has a really good polishing ability. Yeah, when it comes to better polishing, better handling, and easier to polish. Yeah, and then after the follow-up, still the polishing ability, the shiny is still appear. Yeah. For the enamel must be contain one thick layer of composite. So I often see that dentists, they put composite layer by layer, and then after that you complain, why doctor, I still see white line, I still see a junction between each composite. That's because you create a layer by layer composite. For me, enamel must be contain one thick layer, only one thick layer. So you take big amount of composite and then you put that just like that on top of the tooth. Yeah, don't worry about the excess. If you deal with the composite, excess is better rather than under. Okay, this is what happen if you put if you put enamel layer by layer. Yeah, for example, you put the enamel here and then you cure. You put enamel again and then cure. Let's say you create 3 placement or 3 layers and then you cure. If you see microscopic, you will see the junction between each composite. Yeah. So the correct is, yeah, this is what happened. This is why you complain much about the white line or line of junction. That's because of you put the enamel layer by layer. Yeah, that's wrong. How about the sound? Is it good? I'm just checking, yeah. Sound good? Okay. How's the picture? Good? Yeah. Okay. Thank you. Turn off again. So always remember, you have to always remember about how to place enamel correctly. So basically what you have to do is take a big amount of composite and then you put it on top of the surface of cavity, only big amount of composite, and then you will see no junction at all. Yeah, this is a simple trick, but it really works. Yeah, maybe you can imagine if you create a wall. Yeah, let's say you create a wall. If you put wall and then you wait it until it's hard and then you put it wall again, you will see the junction between each wall. But if you put one big amount, yeah, of the material and then you wait until it's set, you will see no junction. But I know, yeah, this is high risk of a bubble appear, yeah, or trap air or irregularities. That's happened because of there's a bubble there. So, or there's micro bubbles there, so that there is an air trap there. So this is the importance of using magnification, and I will tell you how to overcome that condition. So basically what you have to do is, this is the microscopic, the bubbles. Yeah, if there's a bubbles always appear. Yeah, what you can do is to minimize it, not to avoid it. Even if you already place it very gently, very neat, you will still appear. You will still see the appearance of the bubbles. So how to overcome that bubbles or air trap? You can use brush again and again. Brush is help you a lot. Yeah, this is what you can do to minimize bubbles. You use brush and then dip it with the modeling resin first or thin upper bonding, so you can easily reduce or minimize the appearance of bubbles or air trap. Yeah, this is how you use brush. Yeah, very gentle, don't push it too hard. Modeling resin, I use this is stick resin, or you can use from ultra damp wetting agent. But basically, I don't really like the viscosity of the wetting agent from ultra damp. So I use the one from GC. Okay, this is the last how to do polishing. Like I said before, 80% is shade matching. Yeah. You don't need to exactly match 100% of composites. Yeah, that's impossible. What you need is you have to create 70 to 80% correct shade, and then the rest is polishing. You have to create the illusion. How to create the illusion? I only use this 3 instrument. So just remember, only 3 instrument and no polishing paste. Yeah, I never use polishing paste. Yeah, I know this is kind of preventable. I know this is kind of provincial, but for me, the simple the better. Yeah, I want to simplify all the procedure so that you not wasting your money a lot. Yeah, I want to simplify all the procedure. I really like a simple thing. So what I use is the disc, polishing disc. I always call it 3M Softlex. Yeah, because Softlex I think is the best. It's the pioneer. So Softlex is the best for me. After that, you use Dicom If. Yeah, this is Dicom Twist. This is very mind-blowing instrument for polishing. Yeah, if you still use Arkansas, if you still use Stone, yeah, oh my God, that's so old. You have to start to know this. This is really change your dentistry. Yeah, before this, my polishing protocol is really long. Yeah, after I knew about this, my polishing protocol only 3 instruments. I will tell you one by one. The first polishing instrument is my polishing disc here. Polishing disc from 3M comes with 4 colors here. Yeah, each color has a different aggressive surface. But let me tell you something. This is the biggest secret. And if dental suppliers knows about this, they will kill me, actually. But it's okay for you. Yeah. Polishing disc comes with 4 instrument, 4 type. Yeah. They have a different aggressive surface. But always buy the coarse one. Always buy the red one. Do not throw away your money. Do not waste your money to buy all the things. Yeah, because what you need is only this. I'll tell you why. The coarse one, or the most aggressive one, after you use it 3 or 5 times, it will become the other one that has smooth surface. So I use this polishing disc to flatten my surface. Yeah, remember to flatten all the surface. Yeah, not to create a polishing, not to create a shiny appearance, just to flatten out all the surface. Yeah, make sure you use only the coarse. After you use 3 or 5 times, it will become the smooth surface, the smooth disc. Yeah. So make sure, don't throw away your money. Don't you waste your money to buy all the discs. The price for the disc is a little bit expensive. So I think you have to invest your money for our next instrument. Our next instrument is Dicom If. If polishing disc, we use it for flatten the surface. The Dicom If, it comes with the 2 colors here. The pink one, you use it for smoothen out the surface. Yeah, just to make it smooth. You have to use it. If you ask me about the RPM, I never measure the RPM. I don't know nothing about that. Yeah, you can read the manual. but I use it with my heart. I feel it. Yeah, maybe after you have experience, after you use it over and over again, you know the limit, you know the border. Yeah, but one thing for sure, you need to use it gently and intermittent. So that's why I never use water for my polishing, because sometimes if you use water, water can create a bias, water can create a bias. So somehow your restoration will looks like a good polishing already. Yeah, but honestly, in reality, your restoration is not really good polishing. Yeah, because there's water there. So for me, yeah, if you ask me about how if the patient got a sensitivity after the polishing, let's say if you don't use water, for me, I just use it intermittent. Yeah. So the pink one, yeah, it's still aggressive. So gently push, do not to push. And this one is to smoothen the surface. Yeah, remember this for flatten, this is for smoothen, and this one I really like the most. Yeah, this one is for final gloss. Yeah, final gloss. So you can use it, push very hard, because basically it is non-aggressive. So basically, you can use any way you want. Yeah, for final gloss. That's my secret. Yeah, there is no secret anymore. You already know about everything. Yeah, if you have a question, you can write it later. But now I will pause the live and then we jump to the hands-on. Okay. I think I will not post the live. Okay, everyone, I will turn on the command first. I'm gonna ask all of you, how's my explanation? Is it clear enough? Is it I will turn on the music first because I cannot work without music. Okay. So I have a bit of a case here. This one is a little bit hopeless, I think. Okay. So let's do the hands-on. Yeah. So is it clear enough? Okay, so the first thing, suaranya kurang kencang ya. Oke. Karena ada bayi nih di bisa kenceng-kenceng. Tapi nggak apa-apa nih, ini dideketin dikit. Ada bayi. Okay. How's the picture? Is it clear enough? Is it good? Is it good? Okay. Now I will put the bonding agent first. Okay, I will put the bonding agent first. I won't use rubber dam. For direct veneer I think it's more predictable than the other filling. I mean, direct veneer, because you put dentin all over the surface, yeah, the result will be more predictable than any other filling. Yeah, put the bonding first. Bonding, yeah. Blow with the air, and then magic cure. post comment. Oh yeah, I forgot. Okay. Okay, so this is a matrix strips. You know, back then, this is mylar strips. Back then, when I run out of this matrix, I use anything, yeah, like this as my matrix. Or you have, yeah, for this case, I will not use silicon index or putty, because I believe so many of your cases is not for silicon index, or you're not treated it with the silicon index, or with the take an impression before and then send a patient home and then create a wax up. That's really complicated. My patient is always one direct treatment, so it means that I have to create a palatal by using my matrix strips here, by using freehand technique here. Yeah, so you put the matrix celluloid strips here. For the direct veneer, it's very hard to use rubber dam. Yeah, let me tell you, it's very hard because you want to achieve to create a seamless margin over there. Yeah, but when you use rubber dam here, slightly the rubber sheet is covering all the cervical line, so that it will create an excess here, and it will block you, so it will make your work twice complicated, more complicated. So after all, you will reduce a lot of excess on the cervical. Yeah, so make sure that you create your matrix placement like this. Yeah, so you rely on your index finger here by pushing it towards the tooth like this, and then you place, oops, and then you place a packable. Yeah, you use the packable. So I will take the packable here. For packable, I use Tokuyama A2. Yeah, I always love Tokuyama family. Tokuyama family, it's cheap and then good polishing. I really love Tokuyama. Yeah, I'm not even endorsed by Tokuyama. Yeah, because I don't like endorsement something. Yeah, because I'm just use what I like. That's the important thing. It's really hard to use the product that you never use in your daily practice, you know. So you put like this. Yeah, you create the palatal wall very thin, and then take your spatula. Yeah, I never use silicone index, even if the tooth is really hopeless. I think by using matrix strips here, it's more challenging. And I really like challenge, you know. I miss working with the very hard case. So make sure that you create a very good and intact palatal. Only the palatal. Yeah, you're not creating another area, only the palatal surface. Yeah, only the palatal surface. Pardon for my baby. My baby is crying. And then my first son, yeah. use a brush. You can use the brush, the sharp brush and sharp tip here, the one that you use for posterior. It will works. Yeah, it's a bit blurry, I think. Okay, it's a bit blur. I think I need more here. This is the art of using freehand technique. You spend more time to make it, but that's the interesting part, right? But the most ideal is you use silicone index for sure. If you have time and then patient agree with that, you can use that technique. That's even better to get precise palatal. The thing is, you have to make sure the junction between the composite on the palatal, so that when you pull out the matrix, the palatal will stay intact with the cavity. The common mistake is when you pull out this thing and then it just breaks. Yeah, so the key is, here's the key. Yeah, you see in the incisal here, sometimes it's a bit, the inclination is a bit too labial. It's a bit labially. So when you cure it, make sure that you push like this. Yeah, so it will create more excess on the palatal. Yeah, you put like this and then you cure it. The thing is, you don't have assistant here, so that I will do like this. I will push a little bit towards the palatal. Yeah, to make sure that the composite has a good excess on the palatal. Yeah, it's better to create excess on the palatal rather than you create under situation. Don't try this at home if you are alone, because you need assistance for sure. Yeah, you do like this and then you cure, or like this. Yeah, just before you cure, make sure you do like this. Okay, I will push with my light cure. at it, and it's good. I can do that. And now take the flow ball, just like I told to you. Yeah, always make sure the junction between cavity and the composite by using the flow ball. Yeah, just don't pull out the matrix. Yeah, make sure you create a good junction. Make sure you create a good junction, and then you need the sharp instrument. You need sharp instrument here to spread out all the flowable material. And then you cure. Now let's take off the matrix. And this is the wall. This is your wall that you created. So make sure that you create only the palatal side, and make sure that you still have gap there, because the proximal is the job for the sectional matrix for posterior, the ring band. So I will take a ring. Yeah, I will take the ring. Let's see. Oh, that's good. Yeah, without assistance, still good. Okay, this is the job. Remember, do anterior just like painting on a canvas. So you need to create the canvas first. You need to make very thin layer of the wall, and then you put the sectional matrix here. Yeah, so never use strips or the transparent strip, the one that you use for the palatal, for creating the proximal. It's impossible. Yeah, on the otherwise, the result, if you use the matrix strip, the proximal will be so flat. Yeah, this one, the contour is really good. Yeah, it's exactly the same as an anterior contour. So without using any kind of modification, yeah, your proximal already done beautifully contoured by using these sectional strips, sectional matrix ring for the posterior. So make sure that you have to use this always for proximal. Okay, how's everything? How's everything going? Is it good? The sound, the voice. Okay. Is it good? Okay. Turn off again. Okay. Now the proximal. Proximal, I need same composite. Yeah, I only use 2 layers here. So you use same composite as the enamel, and then make sure that the composite place very homogeneous. Yeah. How thick is the proximal layer? It's around 1 millimeters. Yeah. Don't make too thick, otherwise you will steal space for the dentin. Sometimes I use my micro brush dip with the modeling resin. If you have sharper instrument, that's good. Yeah, the best instrument, I think the one from Cosmoden from USA called IPCT. IPCT is the best, but too bad in Asia they have no supplier. Make sure if you have a vacation there, instead of buying luxury watch, maybe you have to buy that. Yeah, just gently press. Make sure that you create a very homogeneous proximal. Don't make it too high, don't make it too low. Yeah, make sure the junction also. So aesthetic requires time. It's impossible to create aesthetic by using only maybe 15 minutes or 10 minutes. It's impossible. I would like to make an analogy. Doing filling is just like cooking, If you're cooking fried rice, fried noodles, within 5 minutes, let's say, it's impossible to get a delicious taste. Same as a composite here. It's impossible to create a very good one within maybe 5 or 10 minutes, because the gut creation is really good. Yeah, so you need time, basically. And then make sure also the proximal, the palatal, there's some excess here that you need to reduce. Yeah, so make sure you use your own mirror to see on the other side whether there's a excess there. You need to reduce before you cure. And one thing, this is the secret. This is what I like the most. This is why I don't ever use wedge. I always push the matrix towards the proximal. You hear that sound, yeah? That's from my first son. He is so active. See, you need to push towards to ensure you have a very tight contact. Yeah, when you push the end of the matrix here, you will guarantee the cervical. You will guarantee the cervical to be very sharp, very tight here, so it will not create too much excess there. Okay. And then when you push like this, make sure you press composite again towards the matrix to guarantee all. To guarantee all the surface, all the composite adapt properly. Okay, and then make sure you place another flowable to ensure that the junction between the proximal and palatal is already good. Yeah, so this is mandatory thing. You need to make sure that the junction between proximal and the palatal is good using only thin layer, no matter shade you have in your clinic. Yeah, shade I think for flowable is not mandatory, because basically what you need is very thin so that you can use it very thin layer of the flowable, and spread it just to make sure that everything went good. Yeah, just before you pull out the matrix and then cure it again. And then take off your matrix. See the excess on the cervical? There's no excess there. Yeah, you don't even need wedge. That's what I told you before. Okay, our canvas is getting ready. So the last is the distal part here. Push again the proximal band. See, so what I like the most about using rubber dam is sometimes because of you use rubber dam and then you already have invert the rubber into the cervical. You can easily place the matrix on the rubber. Wait, the flash is off. Okay, another composite here. Isra, jangan dong. And then do it same as a mesial side. Yeah. Sometimes I would like to push towards the distal, towards the matrix here, to guarantee the cervical less excess there. So always for making proximal, always you push the matrix towards the matrix. Yeah, always you push towards the matrix to guarantee you the less excess in the cervical, so that you don't even require a wedge here. Yeah, because you already ensured that there is no excess on the cervical. Okay, and then you use brush. And then you use this one. Okay, always push towards like this, yeah. And then mind about the excess on the palatal here. See, I have a really good palatal, yeah. This is freehand technique, yeah. So 2 minutes remaining, okay. Instagram rolls 2 minutes, only 1 hour. Or sometimes, because I don't use weights, when you cure, you push the cervical like this, yeah, just to guarantee that there will no excess in there. Yeah, but always push towards the matrix. That's the key. Do the flow ball again. And then cure. Then just pull out. Okay, this is our